Hydrocephalus is characterized by an increase in the volume of the CSF in association with progressive ventricular dilatation, which is nothing but ventricular megaly. Well, the types of hydrocephalus are non-communicating and communicating hydrocephalus. Non-communicating hydrocephalus is otherwise called obstructive. Communicating is called non-obstructive. Obstructive hydrocephalus is the most common type of hydrocephalus. It is seen in children. It results from obstruction within the ventricular system. It is most commonly caused by aqueductal stenosis. Most common acquired viral cause of aqueductal stenosis is mumps. As most common obstruction is at the aqueductal level, there is dilatation of lateral ventricles and third ventricle with a normal fourth ventricle. Communicating or non-obstructive hydrocephalus is due to obliteration of the subarachnoid basal cisterns or malfunction of the arachnoid villi, thus the CSF cannot be absorbed back. Two more common causes are subarachnoid hemorrhage, which is most common, and post-inflammatory due to meningitis. That is inflammation of the meninges. As obstruction is in the subarachnoid space, there is enlargement or dilatation of all the ventricular cavities as well as the subarachnoid space. Investigation of choice for hydrocephalus is MRI because it can demonstrate the extent of hydrocephalus and also the underlying cause. Signs of increased ICT, that is intracranial tension in infants. Separation of the cranial sutures is the earliest sign. Wide bulging anterior fontanelle. Increased head circumference. Papilledema does not occur in infants because the separation of sutures and open fontanelle compensate for increase in the ICP. However, if the ICD rises very rapidly, papilledema may occur. McEwen or the crackpot sign occurs after sutures in the fontanelle have closed, not in the neonate. Crackpot sign or McEwen sign. Projectile vomiting, headache, particularly in the morning, diplopia and sixth nerve palsy. Sunset sign, that is eyes deviate downward because of impingement of the dilated suprapineal recess. X-ray shows beaten silver appearance of the skull due to convolutional marking. Okay, so that was about hydrocephalus. Moving on to pseudotumor cerebri. Pseudotumor cerebri is characterized by increase in the intracranial pressure in the absence of an identifiable intracranial mass or hydrocephalus. The cardinal features of pseudotumor cerebri include headache, clinically resembling the headache of brain tumors, which is typically in the morning, normal CSF, normal size of the ventricle or small ventricle. So, like large ventricle is a feature of hydrocephalus, here it's small ventricle. CT and MRI are normal. In hydrocephalus, CT and MRI will be abnormal, okay? No focal neurological deficit in case of pseudotumor cerebri. There, focal neurological deficit like diplopia and all were seen. Not here. Transient visual obscurations and papilledema with enlarged blind spots are also seen here. Okay. There are certain conditions which are associated with pseudotumor cerebri. Metabolic toxic disorders, and infectious disorders. Metabolic disorders, it includes hypervitaminosis A, hypovitaminosis A. So, like if the vitamin A is high and also if it is low, prolonged steroid therapy is steroid withdrawal. So, if you're going to give steroid for a long time or if you're going to stop giving steroid, then also it can happen. So, vitamin A high and low, steroid giving or withdrawing. Tetracycline therapy, nalidixic acid therapy, and nitrofurantoin. These three go together: tetracycline, nalidixic acid, and nitrofurantoin. Other drugs include amiodarone. Poisoning is lead poisoning. Deficiency is iron deficiency. Hypocalcemia, hyperparathyroidism. And then with the adrenal gland, there is adrenal insufficiency. For the lung, there is chronic CO2 retention. So these are all the metabolic toxic disorders, okay? Otherwise, infectious disorders include polio, GBS, and COM. GBS is Guillain-Barré syndrome, and COM is chronic otitis media. Once again, the metabolic disorders, steroid giving and not giving, and vitamin A high and low. Nalidixic acid, nitrofurantoin, tetracycline, iron deficiency, hypocalcemia, hyperparathyroidism, adrenal insufficiency, amiodarone, chronic CO2 retention. Okay, deficiency வந்து iron and calcium, hyper வந்து lead and hyperparathyroidism, adrenal insufficiency.